our project, Co-Occurring Healing, is with African American seniors diagnosed with co-occurring conditions. Most often they are in recovery and have some other kind of diagnosed mental health condition. So our first quest was to have them name for themselves what should be incorporated into their healthcare. We developed healing circles. They said, let's give an open-ended forum, thematic but open-ended, that people can bring where they are and who they are. What we discovered, first of all, is just how deeply alienated from their culture seniors are when they have been addicted, when they have been incarcerated, when they have been homeless, when they have been poor. And so when we asked them initially, what do you think of when you think of culture? They say, what culture? Prison culture, drug culture, street culture. Black culture came last. What happened in the healing circles was that they began to reclaim a positive identification. They began to say, for much of my adult life, I suffered this, I did that I'm not proud of, I'm still bearing the effects of this, but there was a time when, and then they would describe some incident, some value, some proverb that they learned from a grandparent, from a respected elder. And you began to see them flower. You began to see them realize that is also who I am. That's what got me off the street. That's what got me into recovery. That's what keeps me sober. At the same time, we were taking the data from the seniors, going to the staff then and say, so tell us what you know about African American culture. Well, what we discovered is that 75% of them could not name a single distinctive characteristic of African American people. Believe that culture and wellness are related, but 75% could not name a characteristic. The same 75% could not name one practical way that they try to incorporate the culture into their practice. So then, of course, our training, our enrichment process, which was the other side of this then, began to say, what are the seniors saying about who they are, what they hope for, where their strength lies, and how do we teach that to the providers? And so we developed a series of trainings for them.